I'm only one call away. I'll be there to save the day. Superman got nothing on me. I'm only one call away.
Hello and welcome to a New Look podcast. Thanks to my daughter, she's informed me that if I'm going to do two different types of presentations, the Piper Pods and the Pipecast, that I should actually have a different opening to each one. Now, I can't blame her for being wrong, she's absolutely right. So, New Look Pipecast, hope you enjoy it. If not, we'll move straight on to the meds and we'll continue with the Director of Army Health medications and we'll look at activated charcoal. Now, activated charcoal was added to our protocol. It's been in the PCCM for a while. Now, even though it's not something that is regularly carried around in the INTEG kits, it can be utilised in the hospitals, and realistically, it can also be taken out field, mostly with the treatment teams. But you will see it when you're working in civilian practice, and you will definitely see it when you go on deployment and work in the larger hospitals and the emergency departments. So it's still worth understanding its capabilities and limitations. So we'll move straight in and we'll have a closer look at what activated charcoal is. So obviously it is used for overdoses. Now the difficult thing is it's used for many overdoses. Now there is no real way for you to remember all the different types of drugs that activated charcoal can be used for, okay, because it is so many. So you can see on the screen, these are just the classes of drugs, so everything that falls underneath these ones as well is included, okay. So you've got a mixture of very specific drugs, and then you've got a whole bunch of generic based classes of drugs, so quite a lot. Now, of particular note, you just need to think about the common things that people overdose it with. So paracetamol being a large percentage of overdoses that people will see, mostly because of its ready availability. If you are using activated charcoal, then it needs to be used in conjunction with the antidote. Okay, so the acetylcysteine needs to be used as well as activated charcoal. So you can't just be utilised by itself. Now, instead of trying to remember all the drugs that it can be used on, it can be handy to think about those ones that it definitely cannot, because a lot of them are associated with medical emergencies and pretty bad overdoses as well. So when we look at cyanide and ethanols and isoprophenols, the reason that they can't be used, or activated charcoal can't be used with them, is because they're readily absorbed within the body. Okay, ethanol passes straight through every membrane, so by the time you put the charcoal into the system, it's just not going to work. Okay, now lithium and other heavy metals is basically, they're not very good binding agents. Okay, and lithium's got a terrible habit of hiding in the cells as well, so it's absorbed in the cells, and lithium toxicity usually occurs over a longer period of time, and it's got quite a poor absorption with your activated charcoal, as too does your strong mineral based acids and your alkalines, and that fits in with your heavy metals. Okay, lithium being one of the strongest mineral based alkaline substances that humans ingest. Okay, so that's just a list of what it can't be used. Now, very handy thing that you guys should all do now while you have the chance is, because you're not going to remember the toxicities, because you're not going to remember the poisons and what you can and can't use activated charcoal for and what's the best management that you can do is have these numbers saved in your phone. Okay, so the poison information hotline or poison information center number is the absolute go-to place for all things toxicity. It's a 24-hour service, and they provide amazing advice. You can actually link in with toxicologists if required in order to provide proper clinical advice as well. So whilst having the doctor's information and everything is great, a lot of toxicities aren't readily seen. Okay, and a lot of elements that we work with in the military can be extremely toxic, but very few and far between as far as cases go. So having this information or a place that you can call is absolutely vital. Now, for all those people that love working with animals and care for the animals that you have in your house, there's also a number for the hotline, if you will, for pets. So you can call them, because dogs in particular love to get into things, and you'll be surprised what's actually toxic to dogs that isn't toxic to humans. Things like grapes, raisins, avocados. I mean, you guys have all heard the stories. So if a dog or a cat or any other animal you're looking after has ingested something, you're not really sure what's happening, they're fitting, convulsing, foaming at the mouth, you can give that animal a call and they can pass on some advice. Right, that's enough of the segue. Let's move straight on to the rest of the presentation on activated charcoal for humans. Now, you'll all be very, very pleased to know that the pharmacokinetics for activated charcoal is very, very simple. So it is not absorbed by the human body. That's why it is so good. It is only distributed, well, it's really not distributed. I just left it in there for completeness, but it only stays in the GI tract because that's where you put it. There is no metabolism, it doesn't change, and it is excreted as feces or in feces, completely unchanged. Okay, so that is the most simple pharmacokinetics you will ever learn for any of the particular drugs. Okay, so let's spend some time talking about the pharmacodynamics and why this drug is so useful at absorbing all the different toxins or all the different substances out there. So activated charcoal or activated carbon is just that. It's carbon-based molecules, usually based in some sort of solution. Okay, so when it goes in there, the carbon itself in this particular form is very spread apart. It has a huge amount of pores. So I don't like talking about activated charcoal without people understanding carbon's relationship and the difference between compressed carbon versus charcoal itself, because you sound like it's an infomercial where you're promising the world, but charcoal is extremely porous. Okay, it's one of the most porous substances that you can find. Okay, so if you were to get, let's say, a teaspoon of pure charcoal, its pores internal to the charcoal itself has about the equivalency of surface area as an Aussie rules football field. Okay, now that's not an exaggeration. I'm not promising you any steak knives. That is what it is. So because of that, and because it's carbon, it has a strong affinity to a lot of molecules. Because us organic-based substances are all carbon-based life forms. So everything we induce, everything that can have an effect on us, tends to have some form of carbon base to it. So because of that, when you put pure carbon inside, it has a massive affinity to pretty much everything, and it also has a huge surface area and capacity to store a lot of molecules, both small and larger molecules. Now, because of this fact, it has been picked up by healthcare professionals properly, but using it for overdoses, and it's also started moving into the realms of more alternative based therapies. So you can buy activated charcoal tablets now that promise that you'll that it treats your gas problems because it absorbs gas molecules, or it tells you that it aids in detoxifying your body. So people are taking it, mixing it with drinks, taking it in tablet form, which the jury's out whether it's going to cause harm. But what is known is that if people take activated charcoal tablets, that it can and definitely will have a affinity to over-the-counter medication and other medication that they're taking. Okay, and also even vitamins and minerals that they're taking. And if they take it with a different substance, it's like sugars or low molecular weight sugars, then it can actually affect their electrolyte balance as well. Now, like I said, the jury's out. There's not a lot of studies out there because the doses of these tablets are 500 milligrams, which is not a huge amount in reality compared to the doses that are given in the emergency departments for overdoses. But it is still important to note because you will have patients that probably are taking activated charcoal for a health benefit, and they just need to be aware to be really careful when they're taking it with other medications. So how effective it is? Well, it's not foolproof. You don't put activated charcoal into someone and all of a sudden it absorbs all the medication that you've taken and it's 100% soak up rate. Okay, so it doesn't work that way. Obviously you need a lot of carbon, so you actually need significantly more carbon compared to the molecular weight of the overdose. Okay, so we generally start with 50 grams of activated carbon, and then you can get more than that every 4 hours or so. Okay, but what has been found in a lot of studies is an average absorption rate of different substances is around 47% when given within 30 minutes of ingestion. Now, if you wait 180 minutes after ingestion for a lot of medication, you only get 21% absorption. Okay, so bottom line is the longer you wait in giving the actual activated charcoal, the less absorption you are going to get of that substance. Okay, and the more probability that your body is going to absorb it and it's actually going to go through first pass metabolism into your bloodstream. Okay, another particular note about bolus doses of activated charcoal is it initially work as a plug at the end of the pyloric sphincter, so it stops the actual substance from moving down into the small intestine and therefore staying out of the hepatic circulation. Remembering back to anatomy physiology, there's very few substances that can absorb through the stomach. Okay, a particular one that we use activated charcoal for is aspirin. So if someone has an aspirin-based overdose, you really need to get the activated charcoal in quick smart. Looking at the contraindications and adverse effects of activated charcoal, there's not a lot, which is good. So intestine obstructions is a contraindication because one of the main side effects or risks associated with activated charcoal is that it can slow down peristalsis and cause constipation. So if there's already an obstruction, the activated carbon will sit in the area and then really make a blockage that would be extremely difficult to move. Now, an unprotected airway is particularly important when you're dealing with certain overdoses that cause drowsiness, unconsciousness, seizures, things like that. Because activated charcoal is so thick and difficult to swallow, if there's a patient who's likely to go unconscious or is fighting to drink the activated charcoal or anything like that, then realistically they need to have a more protected airway, and the use of a nasogastric tube can be employed. Okay, so there's a huge risk associated with regurgitation into the lungs and even aspiration as well. So protecting the airway either by having a compliant patient that protects their own airway or doing something about the administration of the drug in order to protect the airway is a definite thing that needs to be looked into. When you're dealing with acute poisoning or overdoses, then you use the solution. You don't bother using the tablets because chances are if they've taken a bunch of tablets and you put the tablets in, the breakdown of those carbons is not going to be fast enough. It's not going to be a greater enough concentration in order to do any good. So it has to be liquid base when you're dealing with overdoses. The main adverse effects, besides the ones that we talked about, is vomiting. Vomiting is a massive one that we need to look out for, and 30% of every patient, okay, so just anyone you give activated charcoal to, will vomit. Okay, I don't think I've heard of any time that activated charcoal has been given that hasn't ended up with a huge amount of mess, vomiting, people spilling it, spitting it everywhere. It's a very bloody messy drug to give. Okay, so just be aware that vomiting is a huge potential. Constipation is another potential, especially with the elderly. Dehydration is a small risk, okay, but just something to look out for. Okay, let's talk about dosage. So this is where the confusion kicks in, okay, because obviously with our approved medication list from the Director of Army Health, they've essentially said that everything that is S3 and below we can give without consultation. Everything that is S4 we must consultate. So activated charcoal is actually unscheduled because it's carbon, it's charcoal. That's what it is. You are eating coal. That's what is happening. So it doesn't have a poison schedule to it. But you have to, absolutely have to, contact the medical officer and realistically the poison information hotline before the administration of activated charcoal. Okay, now whether or not it will cause any harm, okay, is obviously on the other end of really not hurting anybody. But because you were giving it because of an overdose, there can be better and more effective treatment that you can provide for certain toxicities that does not include activated charcoal. So if you spend the time and the effort administering activated charcoal when you could have been doing something else, that's where the risks lies. That's why the experts are needed to be called before you administer activated charcoal. Now it comes in a whole bunch of different suspensions. Okay, so the one that is generally given in the emergency departments is the 50 grams and 250 mils, and they're required to drink the 250 mils. That's it. They drink the 250 mils, and then you can repeat the dose every 4 to 6 hours, depending on what the experts say associated with the toxicity that you have. That's it. Now, there are a lot of specialised rules associated with poisoning, so we're not going to go into each of them because you are all going to call the poison hotline before the administration. So we've already taken care of that. Now, activated charcoal tastes horrendous. Okay, it's not supposed to taste good. So some people can have a lot of trouble getting activated charcoal down. Now, you can utilise the use of a nasogastric tube. Nothing wrong with that at all, but that in itself can be irritating. So it can be mixed. Now, the civvies say that it can be mixed with ice cream. But if we're in the middle of the field and had the luxury of ice cream, well, maybe field wouldn't be so shitty at times. But it can also be mixed with water. If you are going to mix it with your soft drinks and your juices and that sort of thing, just be very careful of the concentration in which you are mixing, because the charcoal will start absorbing the glucose molecules of the actual solution that you're mixing it with, and therefore you're getting less charcoal in the stomach. Okay, so just something to be aware of. Hey, finally, our take-home message. I've already talked about them a lot, so we'll just quickly go through them. We have to call the medical officers and the poison information hotline before the use, and we already have talked about why. It is an excellent idea to save those numbers in your phone. We're always going to have our phone, so save those numbers in the phone, so then when you need them, you don't have to rely on memory to try to figure out what it is, and you don't have to rely on internet access to get the numbers. So just save them in your phone. You don't do anything else with this presentation, just do that. If you suspect overdose, the goal is to give activated charcoal as soon as possible. Now, I know it's difficult because we have to call the doctors and the poison information hotline, but as soon as we get the go-ahead, you need to administer the activated charcoal. You need to remember the airway factor. If this person has a risk of unconsciousness or drowsiness, then we need to consider if we need to protect the airway first with supraglottic airways at times, or the use of a nasogastric tube, but it must be done. Okay, if you are at all worried, make sure suction is close by as well in order to help get those little carbon molecules out of the person's mouth. Now, using solution-based substances that induce vomiting is no longer a thing. Now, I haven't met many new clinicians that actually think it is a thing to use solutions that induce vomiting, but just to let you know, it is absolutely not a thing. So the use of Ipecac solutions or syrup is not a thing. Now, for all you diligent medics out there that have read through your approved medications, you will note that there is Ipecac solution written on our approved medication. And that, I honestly don't have a good answer to that, because when you look through the 9th and the 10th edition of the PCCM, the only reference to Ipecac solution is saying that it is not recommended and not to be used. So you can carry Ipecac solution, but it's just going to look pretty. You're never allowed to use it. Okay, that's the bottom line. Other things that are no longer recommended is the use of sorbitol. So sorbitol is a very low-based sugar alcohol, for lack of a better term, and it's used as a laxative. Now, they used to, and some places still do, mix the first activated charcoal with sorbitol, knowing that it's going to slow down the actual flow of it through the stomach or through the intestine, therefore increasing the probability of it soaking up the substances. Now, over time and further studies, it's sort of been proven that it doesn't happen, and the continued use of sorbitol actually robs the body of a lot of electrolytes. So, current recommendation is sorbitol is out, Ipecac solution is out, activated charcoal is used by itself in its purest form when it's needed. Okay, that is the end of the Pipecast on activated charcoal. Hope you've got something out of it. Probably not a drug you've looked at before. As with all drugs, comes with their particular niches and things to consider. The next drug that we are going to look at will be our different types of clindamycins. But until next time, take care.